I'm Dr. Howard Winston, and I'm the Medical Director at the Center for Health and Sports Medicine, which is where we are here today. And I'm staying here with
Beverley D. Burdeyney.
And Beverley has given me this balloon to play with because she has created a whole system of exercises that you can do with the balloon. Now, this is a typical balloon that you would see at any birthday party or any kind of decorative celebration. But what this balloon has the capacity to do is to improve the strength of muscles of the body, posture of the body, without any kind of harm. A lot of times we're looking for new exercises to do that are convenient, that aren't expensive, and that will not damage the body. Hard pounding, jumping, twisting kind of motions we're not too keen about, and lots of people do that. But what we're more interested in is how we can use this type of item, the balloon, that has pressure in it, has potential pressure, to our advantage. And just a very simple example of that is what I'm doing right now. I'm squeezing this balloon with my two hands, and I'm using a number of muscles to do it. It's more of a isometric type of exercise than isokinetic or isotonic. And by doing it, the longer I do it, the more the muscle is stressed. The more the muscle is stressed, the more the time the muscle, there will be breakdown of fibers, and the fibers will regenerate and build more muscle. So it's not in any way an abrupt motion. It's a continuous tension that I'm providing against the balloon. And you can see, of course, the balloon is staying the test. It's not bursting, and there's no deflation of the balloon. But these are some of the things that we have to look into as well to make sure, because I'm just pushing the balloon. Other times you may sit on the balloon, or you may have the balloon in other areas where there's more pressure, and we've got to make sure that they're durable, that the balloon doesn't break and startle you, because that, of course, can be an insult to the muscles as well. But the whole concept, and using this in different areas of the body, I'm just showing you with my hands and my arms right now, and my shoulders. But you know, as Beverley can demonstrate, it can be used. Yeah, this way.
This way.
Yeah.
And the other way.
Yeah.
Turn around to the.
Yep.
And now
another application.
And just press it in, and pressure hit into the balloon.
So again, this is just one of many areas of the body that it's used.
Good. It relaxes the body. And
it is relaxing. There's no question. No question. It is relaxing. It's a relaxing exercise to do. And although you may not think it's exercise, because we think of exercise as a dynamic process, but this held in place and me putting pressure against it is by all means a form of exercise. And as I mentioned, there's different types of exercises. There's isometric, there's isotonic, and there's isokinetic exercises. And this is more of an isometric, so you're not going to see much motion, but there's certainly the muscles are working. And that's what I like about it. And when you came to me with this idea, I've seen you in the past as a patient, I thought, a little bit peculiar, but interesting. Let me hear about it. And when we went through it, it was very therapeutic. It was very relaxing for me. It was not the typical, you know, work hard, build up a big sweat, heart rate up. This is a different type of exercise, and I think there's a real application for it, not just in the form of exercise, but even in treating depression and things like that. I mean, we know exercise is a positive, has a positive outcome on those who have psychiatric conditions, particularly depression. But I'm saying this type of particular therapy, balloon therapy, I think would really have an impact on people who are depressed as that form of exercise to help treat depression rather than medication. So I by all means endorse the concept of balloon therapy, and you were kind to come here and demonstrate to our staff. There were some concerns I told you that I had in regards to the durability, and it shouldn't burst and startle a person. And latex allergies was also an issue that you mentioned. But once those things are looked into and achieved, I think it's limitless, the capacity, and for those who would use it. So I salute you. You know, congratulations on the concept, and it's a privilege to be involved in, you know, endorsing and promoting it, and I wish you the best of success.